Right, let's open. So we're going to skip case 3 and go straight to case 4. So case 4, let's have a look. So this patient comes in with left-sided weakness, right? So let's have a look at this one and feel free to go through it. I'm going to go to the brain windows. We're going to scroll through and keep scrolling, keep scrolling. So let's go from the top. So the brain parenchyma can be really, really subtle. And one thing you're looking at is gray-white matter differentiation, and it takes a little bit of getting used to. But if I was to zoom in to the brain parenchyma a bit further on, you can actually see that there is almost a linear sort of region over here, which is slightly hyperdense. That's going to be your gray matter. And then over here is going to be your white matter. Those are the motorways, the axons that all communicate with one another. And the reason it looks lower density than the other stuff is because it's more fatty than the gray matter. And the gray matter is quite dense material where, a lot of your thoughts and personality hides away within that area there. And the rest of it's sort of just communication between one another. And you do have areas of gray matter further deep within the brain as well, which I will try and point out as we go along. This kind of blackish stuff is going to be the CSF fluid. That's completely fine. And you'll see the lateral ventricles sitting here, here, and here, and here. And that's completely normal as well. So as we scroll through, we know this patient's got left-sided weakness. So let's have a look and let's see, has anyone said anything? No one said anything so far. That's fine. Let's kind of go from the very, very bottom. It's being a bit jerky for me, so I'm just going to download the images temporarily to be able to get a kind of a smooth, yeah, there you go, look how quick that was, and nice, smooth scroll. And we're looking for left-sided weakness coming up. Haven't really seen anything, have we? Actually, maybe around that point there. So can you see there? Look at that little dot there. Can you see that? That doesn't look quite right to me. Let's zoom in a bit. So it looks slightly different. So then what you've got to do is look at sort of the similar area on the other side. And if you need to straighten out the brain, you straighten out the brain. So these are the Sylvian fissures. And then within there, you've got sort of the MCA. And that looks dense. And you can't really see anything like that on the other side. So it's clearly asymmetrical, definitely asymmetrical. And then as you come further up, you just do feel like there's a slight difference. So you remember when I was talking about the gray-white matter? So there's kind of gray-white matter, but this looks a bit different. It looks a bit low density within this region over here. So in that particular instance, when you've got what looks like an MCA dot sign, it literally looks like a dot, because what's happened is you've got a thrombus, maybe in a small thrombus, but you're seeing it end on. It just happens to be the way the CT is taken, and you're seeing an end on vessel which has got a thrombus within it, given this MCA dot sign. MCA dot sign basically means that this patient has got an underlying thrombus and will need to be thrombolyzed or sent off to get a thrombectomy. And if I remember correctly, I might have uploaded the CT scan for those of you that don't believe. Let's see, I think this could be the CT scan, so let's have a look. So case number 2. Maybe just another example. Hang on, let's open this one. Let's have a look. Let's go through. So scroll through. So look, actually, look, this is actually another example of the same thing. So if we kind of go from the very, very top. Okay, so look, this one has got slightly smaller CSF spaces, probably a slightly younger brain. And as you scroll through, almost identical in appearance to the other one, you're going to end up having a little dot that appears. So look, there you go. See that? That little dot there compared to there? Looks very, very different, doesn't it? Let's zoom in a bit. And just to convince anyone, but over there, compared to that, that looks slightly brighter. And that's how subtle these things can be, That's how subtle these things can be. And as you scroll through, you can actually feel as though you can see a bit of end-on vessel and then more of that vessel looking hyperdense going along that way. But on this side, it looks completely fine. It doesn't look like there's very much going on. And then, if I remember correctly, we do have the MRI scan for this patient. We will go straight for we can go for the SWI, I suppose. So if you look at the SWI, so any blood product will have a big signal void. So you just feel like a big void of signal with any sort of blood product, like slightly more acute blood products or thrombus. And you can see that area there looks linear and very, very sort of hypo signal. And then MIP images wise, yeah, you can see that again. Look, very, very sort of hypo signal there. Let's look at the T2. We might see a bit of extra brightness within that region, which can be difficult actually on T2 to see like extra brightness because you need that sort of dampening down of the surrounding fluid. And again, look, when you come up to the FLAIR images, look at this area here compared to that side. So this looks brighter, doesn't it? So this doesn't look quite right. Then if we go to the diffusion weighted images, so what we're looking at in diffusion is looking for bright areas, because if you've got a bright area, that means there's restricted diffusion. And the way I try and explain this diffusion thing to you is that, like, for those of you that got kids, you know how active they are, right? So especially if they're very, very active, mine are 4 and 7. If you try, like, let's say they're getting into one of their little kind of moments where they really want to run around and jump and go, have a great time. And if you were to hold that kid tight and say, you're not allowed to move, you know how much they wriggle and fight and all that kind of thing. That's pretty much what a thrombus is like. So if you're trying to hold a thrombus or an area where they've got a lack of blood going through, all those little kind of water molecules are restricted in their movement. And because they're kind of thrashing about, they've got energy that they can't get rid of, and they just shine bright. And that's what happens on the diffusion weighted images. There's no science behind that explanation, by the way. So please don't go and say that, Imran said the science behind it. But look, on the DWI images or ADC map, you can see that there's low signal in the corresponding areas, right? And look how significant that area is. It's quite a big infarct that we can only see a little dot for. So really, really important to, really keep your eyes open and be open to the idea that there may be something called an MCA dot sign when it comes to this kind of imaging. And this particular image, we've actually got the MRI scan to prove what we saw. And I think with this particular patient, they ended up just having and continued weakness. They had really strong clinical suspicion. They thrombolized, and then they also did an MRI scan to try and characterize it more, and that's what they found. So did we have the, let me just see if we had the, sometimes you get an MRA, let's see if we had that, I can't remember now. If we haven't, sorry, apologies if we don't, I can't see it. Okay, fine.